My name is Paige Crane, and I am a Career and Education Outreach Specialist with Workforce Solutions Capital Area. Today, we are joining to look at the career pathway of nursing, and we are joined by an amazing panel, and we're going to go over some information so that everyone has a good understanding of what it takes to hop into this amazing career pathway. So we'll start with some introductions. Then we'll look at the labor market information. We'll have our panelist introductions, and we'll have our Q&A. And we'll also have some amazing resources for our students. So I'd also like at this moment to introduce Jessica Durson.
Hi, good morning. My name is Jessica Durson. I am the Director of Career Awareness and K-12 Partnerships at Workforce Solutions. If you are not familiar with the capital area, our mission is to connect local people to local jobs. So we like to provide labor market information, resources, tools to really help bring awareness to these high demand career opportunities and industries in the Austin metro area. So we're really excited to have you all on this call. We have some great panelists. I recognize there's some Lockhart High School students in the room, so thank you all for joining. Definitely, as we go along, please write down some questions if you have any, and we'll have some time at the very end that you can ask our panelists, but pass it over to Paige.
Wonderful. Thank you, Jessica. All right, so we'll start with this video.
Registered nurses, or RNs, are the largest healthcare occupation for good reason. They give patients medical care, educate them about their health issues, and offer emotional support. These medical professionals observe and record their patient's condition. They help perform diagnostic tests to make effective plans for patient care. Before patients head home from a treatment or procedure, RNs explain how to manage the illness or injury. A core part of medical teams, they consult with doctors and other healthcare professionals and may oversee the work of other nurses and assistants. Registered nurses work in hospitals, doctors' offices, home health care services, and nursing homes. Some work in correctional facilities or schools or serve in the military. Nurses may also have the opportunity to travel as they are needed across the U.S. and around the world. Risks such as back injuries from lifting patients or exposure to infectious diseases and chemicals are part of the job. They may work nights, weekends, and holidays and be on call in off hours. There are 3 paths to become an RN: a bachelor's degree in nursing, an associate's degree, or a diploma from an approved nursing program. They must also be licensed. Some nurses earn a master's or doctoral level degree and work in management, research, or academic settings. Combining competence with compassion, nursing is a career that improves and even saves many lives.
All right, and that takes us right into our labor market information.
Thank you. I'm actually stealing the deck for a second because I did include an additional slide. I will go over the labor market information with you all. It's really important to always recognize especially for young people or adults, when you're looking into college, higher education, or any sort of post-secondary training, you want to make sure there's a demand for the career that you're being trained in. So I'm sure it's no surprise to most of y'all on this call, there is a very high demand for registered nurses of all sorts in our area. There was a 20-year nursing shortage even before COVID, and it's been a national issue. So that's always really great in terms of the opportunity that most students and young people are expected to have, not only in Austin, but nationwide. This graph here will show kind of the national supply and demand between 2000 and 2020. So you notice the demand, that line continues to go up while the supply actually went down. So, you're guaranteed a job, especially if you go into the LVN nursing sort of career pathway. This labor market information was pulled for a year span from October 2021 to October 2022. And these were the top online job postings in the healthcare profession. So top of the list at the very top, are going to be registered nurses. There was over 10,000 job openings in the Austin metro area. So that includes Austin, Round Rock, Georgetown, as far as Caldwell County, Hayes County, that general Austin metro area. Next to RNs were medical health service managers, LVNs, critical care nurses, nursing assistants, medical assistants, personal care aides, medical secretaries, dental assistants, and patient representatives, kind of going down the list. Most of the challenges in nursing have been for faculty and clinical placements. We also see that there's shortages in entry-level pathway occupations. So when we say entry-level, most hospitals and practitioners are looking for ways to bring in young people at that entry-level point. And most hospitals, in fact, will actually upskill their employees in providing tuition reimbursement, tuition on-the-job training. You're going to learn about St. David's Galen School of Nursing here in a little bit to learn more about how they're upskilling their employees within their hospital system as well. All roads lead to nursing. So at Workforce Solutions, we're always looking at, again, upskill young people or even adults into these nursing pathways. So this graphic kind of shows you someone can start as a certified nursing assistant, and then maybe they become a patient care technician. Maybe you don't want to be a patient care technician. You can go from certified nursing assistant straight to LVN to registered nursing. So there's different pathways for you to get to that end goal, which is nursing. And this graphic kind of shows you how you can do that. I don't know what it looks like on y'all's screen, but looking at it a different way, another individual can go into CNA, to patient care technician, to maybe MA, medical assistants, down to either LVN or registered nursing. So really there's a lot of on-ramps, off-ramps for you to get into the field, learn about the profession, and really eventually get to that end goal, which is becoming a qualified, skilled nurse in our hospital system. Next slide here. This is another graphic that we like to share, and I am happy to send it out after this presentation, but it's really cool because it kind of breaks down the different healthcare occupations based on like specialty. So this top left corner talks about occupations that are in diagnostic and therapeutic area, which is going to be like your radiologist, pharmacy tech, respiratory therapist. And then on the right side here, we have nursing and clinical, which are going to be clinical lab technicians, LVNs, RNs, substance abuse. Down at the bottom, you have your health administration careers. So those are going to be like your office positions, such as medical secretary, medical records and health information technician, health services manager. And then to the far left, we have our dental. And that is a pretty straight career path, which is going to be your dental assistant, hygienist to a dentist. So definitely for the young people on the call, start thinking about which kind of area you see yourself in, whether it's therapeutic, clinical, dental, or even health administration. They all have really great career opportunities. And then again, I'll share this out with y'all afterwards so you can look into the data a little bit closer. Another statistic we like to share with job seekers is the training and education requirements for each industry we focus on. Pulled some data for healthcare jobs as of Q2 of 2022, and we see that, I don't know if this is on the call, but actually more jobs were needed with a 2-year degree or certification than any other education requirement. So there were over 30,000 healthcare jobs that only require a 2-year degree or a certification. Now, I always like to share this because we call these middle skill jobs. And I remember when I was a young person, you always think 4-year degree, graduate school, but surprisingly enough, in Austin, there's a lot of really well-paying jobs in Austin that only require a 2-year degree. Get to that, 20,000 did require a bachelor's degree, and then 16,000 did require a postgraduate degree. Just a few more slides. In the last 10 years, Austin Workforce Solutions has been focused on nursing grads and increasing that number each year. So we actually have a graphic here that shows that we had 955 nursing graduates in 2021 to 2022. Last slide. I wanted to share this with you all, and I will link it in the chat once I'm done talking. Workforce Solutions has these really fun, I think they're fun, colorful, dynamic career profiles that are available to job seekers and students. This one here is about the registered nurse career, and it shows kind of the wages that someone will earn in the career pathway, the projected number of the next 10 years, job duties, a short little video that you can scan through this QR code. On the back, we have how to get started in this career pathway. So for instance, make sure you're taking STEM, English, foreign language classes while in high school. See if you can find a part-time job at a clinic or doctor's office. And then we also have some related jobs with the salaries. So I will link this in the chat as well. We have 100+ career profiles, which are really great, especially for teachers and counselors to kind of print these out and have conversations with students and job seekers about what sort of careers they see themselves in. And we have over 100 of them, so definitely check those out. All right, Paige, I'm going to stop sharing and pass it back to you.
Wonderful. Thank you so much. All right, so now we get to the experts. We have some amazing people here that are going to share their wealth of expertise. Dr. Beth Vaughn. Oh, sorry.
Hi, again, my name is Beth Vaughn. I'm the Division Director for Academic Partnerships for St. David's Healthcare. Nice to meet you all, and thank you all for being here. I'm very excited to help share about my passion for nursing.
Awesome, thank you. Dr. Jessup.
Hi, everybody. I'm Dr. Jessup. I'm the Associate Dean here at the Austin campus for Galen College of Nursing. And we're excited to have you here and work towards your pathway to a nursing degree.
Thank you. We have Eric Stratton.
Hi, everyone. My name is Eric Stratton. I'm a faculty member here at the Galen College of Nursing Austin campus. I specialize and teach med-surg, adult med-surg classes, and also clinicals and the the LVN to ADN program, as well as in the BSN program. And looking forward to giving you some information here. And hopefully, no matter what, you all get out there and you have fun and do good things, whatever your career path takes you.
Thank you so much. Dr. Sally Stroud.
Hello, my name is Dr. Sally Stroud. I'm also on the Austin campus. I teach at Galen College of Nursing. I focus on the med-surgical focus and transition to practice. I also emphasize passing the NCLEX exam, which is required to practice as a licensed nurse. Looking forward to working with you.
And Dr. Rachel Bennett.
Hello, I'm Rachel Bennett. I also work on the Galen College of Nursing campus here in Austin. My focus is pediatrics. I work with the BSN students when they first start into the program. I also touch base again with them in the community health component. And then I work with the bridge program, so the ADN or the LVN to ADN students in their pediatric course.
Wonderful. Thank you all so much for being here. All right, we have a few questions. Our first question is to briefly speak on your educational background and why you decided to go into nursing.
All right, so I want to cover that question. I knew from a very early age that I wanted to be a nurse. It was just a passion that I had from a very young age. My little brother was born when I was 6, and I just really felt that I mean, my mom might disagree, but I felt like I raised him. I did a lot of his care, and that just gave me a passion for taking care of people, taking care of babies. So I went into nursing school straight out of high school. I had the opportunity to take some classes that counted for college credit. while I was still in high school. So I started a little bit ahead, had a lot of my nursing prerequisites done before I even graduated, and then was able to start pretty quickly into my nursing program. I started with an associate's degree in nursing because that's what was available to me. I was 17 when I graduated, wasn't quite ready to leave my family before heading to the big city of Austin. So I worked for a couple of months after getting my associate's degree, got my bachelor's degree, and have carried that on to get my master's and my doctorate. So I worked with St. David's actually in the NICU at North Austin for a really long time, spent a couple years traveling, came back to the NICU at St. David's, and then decided to go into teaching full time.
Wonderful. Thank you so much. All right. Our next question is, what are the different nursing programs and what are the differences between them? And we'll start with Mr. Stratton.
Sure. So there are three different main levels of nursing, at least at the basic level. You've got your LVNs, which is your licensed vocational nurse. From there, you've got your associate's degree nursing program. And then from there, you have your bachelor's of science in nursing program. Those are your main levels of nursing. Beyond that, you can get into your higher level degrees where you get into your master's of science nursing program and then into your doctorate as well. But in terms of like your entry level programs, as high school students, you have pretty much three major choices, which would be your LVN, your ADN, or your BSN. So the program that I teach in is I teach in the ADN program, the Associate's Degree in Nursing program. Now, what's unique and different about the ADN program that I work in is that I'm working in a program where we're taking practicing licensed vocational nurses who are looking to grow and develop themselves further in the nursing program and nursing community. They want to grow from LVNs to become registered nurses. There is a difference in the practice scope between a licensed vocational nurse and a registered nurse. And so the things that you can do as a registered nurse do differ. One of the things that we emphasize in registered nursing is we talk about delegation. As a registered nurse, you have the ability to oversee a team. The LVN is part of that team. So you have the opportunity to learn how to be part of that team and oversee that team. You learn a little bit more about leadership when you get into the ADN and the BSN program. LVN is a good way to get your foot in the door. You can become a nurse quicker if you go through the LVN program. Most programs, including our program here at Galen that my colleagues are going to talk about, you can do it in 2 years. With an ADN program can also take 2 years. The prerequisites, but you have prerequisites that you have to take in order to get to your ADN program. Whereas with the LVN program, you can pretty much get right started from the get-go. Versus the BSN program, there tend to be further prerequisites, and it takes a little bit longer. At Galen, we offer one that you can do in 3 years, depending on your prerequisites, whereas at a lot of colleges and institutions, it'll take 4 years, 2 years of prereqs, and then you get into the nursing school itself, and then you're out in 2 more years. So it tends to be a 4-year-long program. So those are fundamentally the very basic differences in the programs and the levels, and you've got so many different pathways you can choose from, so many different ones. It like was stated earlier, where you can come in from the basic and work your way up. I came in as a clinical assistant. This was a second career for me, and I ended up taking the prerequisites while I was a clinical assistant, and then worked my way over and into the program and became an RN from there. So I encourage you to look at the differences and pick the path that's right for you, but know that it's never too late. I'm working with right now with some LVNs who are becoming ADNs who have an average of 10 years of experience as LVNs and are now deciding to get back to it. So no matter what, there are always opportunities, always interesting chances in the nursing field, both within different specialties and also to move up. And excuse me, with every opportunity to move up, there's opportunities for advancement in salary, responsibility, and changing dynamics. You can always have something new and different to do when you're becoming a nurse and working your way up and around the field. So that's pretty much some of the differences in the programs and what you can get from them, from my perspective.
Wonderful. Thank you so much. Dr. Stroud?
Yes, as Dr. Stratton was saying, the programs are divided into 12-week quarters, and they're very accelerated. I'm currently working with the LVN program. That's a 12-month program, and we start clinicals very early in the program. But we also focus as well throughout the program on passing the NCLEX boards. In our current graduating class in December, 100% pass rate of all the graduates that sat for the exam for the first time. So we're very proud of that. We work very diligently on a program that is individual based. We work on their mastery level and are very focused, intentional on increasing that mastery level throughout the semester, working on the different areas. And I'll just talk about a few of the curriculum areas. We discuss management of care, pharmacology, physiological adaptation, reduction of risk potential and basic care, health promotion, psychosocial integrity, basic care and comfort. Those are all requirements to sit for the boards, and each program, the NCLEX PN, NCLEX stands for National Council Licensure Exam. The RN sit for the RN exam, and the LVN sit for the practical nurse exam. So they're different. They have different scopes of practice, as we've already alluded, and those are the major areas that I focus on.
Wonderful. Thank you so much. And Dr. Bennett?
So I predominantly teach in the BSN program, which has already been covered, is about 3 years. The length of time, the reason that this program is a little bit longer is because the BSN nurse would have increased responsibilities upon graduation. The BSN program, the courses go deeper into the content and really lean heavier on that critical thinking, because these would be greater responsibilities that the BSN nurse would have upon graduation. So when we look at potential opportunities in nursing, as far as that advancement, the BSN has the greatest potential. But like Mr. Stratton said, it doesn't really matter where you get started. There's always the potential to keep going. One of the things that we really foster in nursing is that idea that your learning is never done. Even if you don't go on, you don't get any more degrees once you decide whatever your path is, there's always the opportunity to learn more at the bedside, how you take care of your patients. And science continues to change. I think that's the most fun thing about nursing is, I've been a nurse for, I don't like to put a date on it anymore because it's really getting up there. But it has changed so much since I first got into the profession out of nursing school. And I just find that fascinating, that it's just, there's always something new to learn to take care of your patients in a better way and provide better care.
Wonderful. Thank you all so much. All right, our third question is, what does the curriculum for nursing school look like for the different programs? And we'll go back to Mr. Stratton.
Pesky mute button. Sorry about that. So the curriculum for the program that I'm in, the ADN program, it's when you come in, obviously you have to start out with the prerequisites, and a lot of times the prerequisites are involving you've got to take anatomy and physiology, microbiology, the different things like that, in addition to English and some of those classes like that. But then once you actually are in the nursing core curriculum, first course that comes out of the chute is the course that the students take with me, which is basically a foundations course, or kind of a med-surg 1. And this is a course where we basically start taking a lot of that anatomy and physiology sort of theory, and now then applying it specifically to nursing. And the curriculum gets into what it's like common pathophysiological conditions. So basically you take, now that you've learned what the anatomy and the physiology, how the body is supposed to function, we start now looking at what happens when the body doesn't function properly. And it's not just that, we now look at it through the lens of how a nurse should approach this. So we start looking at and getting into and delving into the actual nursing process. So this is where we start looking at and start determining and seeing the differences between what the scope of nursing practice actually means. There tend to be also some other courses, and again, different nursing schools will do it a little bit differently, but fundamentally it may be a different course, it may be embedded into med-surg, but you start looking at, okay, what does it mean to be a nurse and what separates the nursing process and the nursing as a profession from, say, medical and from being a doctor. And we delve into that and look at, okay, based on what's wrong with the patient, then how do we as nurses approach the healing process and what do we do? And we start thinking about it. And just so you know, from the very beginning, the very early stages, the get-go, right out of the chute, we're starting to teach our students not just how to approach these pathophysiological conditions and look at things like a nurse, but also how to think critically, using our brains more critically, and also how to think about things through the lens and perspective of the NCLEX. As Dr. Stroud had mentioned earlier about what she does for the LVNs, it actually starts pretty much from the very beginning. What we do is we try to make sure that our students are prepared at the very beginning to make sure that they know what the NCLEX style questions are like, and we embed that throughout all of the curriculum. So from there, you start out with basic med-surg, and you get clinicals as well. You get lab experience. So clinicals, you'll literally go into the hospital and actually get opportunities, whether it's starting out with a nursing home, then maybe then after that, going into the hospital, applying what you're learning in your theory course at the bedside. And that may look like an opportunity to pass medications under the supervision of your professor, and getting a feel for actually being the nurse. And what's so really cool about the nursing program and curriculum, regardless of where you go, but especially at the ADN program, and what we do is you actually get to experience being what an RN is like at the ADN level. And we teach the students to be thinking about, okay, we're in the curriculum, you're in the nursing program, you're in clinical, what do you do? And a lot of times with my students, it's, okay, you've been an LVN, but now then you're transitioning over to become an ADN. How do you do things differently? What's different about what you do now versus what you were doing as an LVN? And that's really handy. So then you progress up through the curriculum, and you'll take courses like Professor Bennett mentioned. You'll go and take courses specifying and specializing in things like pediatrics and mother-baby, in mental health, and then community health, because we want to build well-rounded nurses. I can't emphasize this enough, so many people think, the answer to the question when you say, oh, I'm a nurse, people follow up and say, oh, what hospital do you work at? There is so much more to nursing than just working at a hospital. Let me emphasize that to you folks out there. There is so much more to nursing than working at a hospital. And what nursing school does and what the curriculum and program does is give you that opportunity to see all the different aspects of it. Now, say that's true at every one of the programs that we do. We give you a little taste. As you advance up, if you're going to do ADN versus LVN versus BSN, they give you a little bit deeper look and a little bit different things. And my colleagues can get into that. But fundamentally, that's kind of what the ADN program does. You get more depth into further med-surg rotations, more opportunities to do deeper dives on pathophysiology, the conditions, the passing of meds. It usually culminates with kind of a capstone program where you have an opportunity to, or something of that regard, where you have an opportunity to pretty much almost be on your own. I mean, you've got your nursing professor supervising you, but you have a lot more leeway because you're just one step closer for me being out there as that registered nurse on your own. And then after that, if everything lines up and goes well, you walk across that stage, and then you take that NCLEX, you pass it, you got your license, and then you're out there practicing. So that's pretty cool.
Thank you so much. Dr. Stroud?
Well, I think you did an excellent job of explaining the program. The only thing I would add is some of the skills are different. The RN program, we teach IV skills, and the nurses are so excited about learning those skills. They feel like a nurse, and they're able to practice those under supervision in the clinical area after they learn that in the laboratory. We also, the LVN program, in addition to that, we focus on Foley catheter insertions and wound care. So they're able to provide that care. And the LVNs that are graduating are getting leadership positions, charge nurse positions. They are usually already working in their environment and able to move up in the facilities that they're at or the organization they're working in. So we really do start teaching the students how to develop their thinking, how to act like a nurse, and to transition them into professional practice. And so it's very rewarding to watch nurses can move through the program and develop that confidence and that knowledge and the skill that they can project as confident and competent nurses.
Wonderful. Dr. Bennett?
I don't think there's too much left to cover here. Both Dr. Stroud and Mr. Stratton did a great job of explaining the differences. I would say that because the BSN program does give the student the greatest opportunity from graduation, I think the BSN program does lean a little bit harder into the potential for leadership. The aspect of critical thinking, that's something that we cover very early on. The students start clinical experiences in their second quarter in the BSN program. And then, like Professor Stratton was saying, there's so many different opportunities, so many different experiences that the student gets to have in this program, whether it's pediatrics, mother, baby. So even if you know that you want to be a nurse, but you don't know what kind of nurse, you'll have a great opportunity of working a little bit of time in each of our major categories of healthcare. So maybe by the time you graduate, you know, I want to be a baby nurse, or I want to work in mental health, or whatever that potential is. Because like Professor Stratton said, we do want to create well-rounded students that have had lots of experiences. So when they get into their program, or whenever they graduate the program, whenever they get into their professional element, they're able to hopefully go into something that they already have a passion for.
Great information, y'all. Thank you so much. All right. Our fourth question is, what advice would you give high school students to prepare for a career as a nurse? And this will be to Dr. Vaughn.
Yeah, I can definitely help with this question. I like to say all paths can lead to nursing. So if you're looking to explore profession in nursing, I would recommend looking for opportunities to shadow a nurse so you can learn more about the profession. You could volunteer at a healthcare organization. You can connect with Workforce Solutions, and they can provide you with information on events like our recent St. David's High School Interview Day or field trips at our simulation centers at our hospital. Workforce Solutions also provides information on events at local hospitals and local schools, like the upcoming open house with Galen College of Nursing. You can also reach out to Capital Idea. They can help you with funding your journey through nursing school. You can connect with your school's HOSA program, which stands for Health Occupation Students of America. This program in high school provides opportunities to be exposed to healthcare. You can also set up an appointment with your healthcare counselor and talk with a health school health science teacher. Even getting your CPR certification can prepare you for a nursing career. St. David's Healthcare wants to help students get a head start with their career goals by offering entry-level positions in healthcare to high school graduates while supporting you on your journey to nursing. We can help you balance your school and schedule. And there are many ways to enter into healthcare and many pathways for nursing. So we can help you with that journey.
Wonderful. Thank you so much. And our final question, what would you say are the top 3 skills needed? And which courses do you recommend students take in high school? And this will be Dr. Jessup.
Hi, everybody. So yes, I think one of the things that Professor Stratton said is that there's so many other things to nursing besides working in the hospitals, and that's so true. So when you look at your top 3 skills, nursing has so many pathways. You can be a hospital nurse, you can go academia, you can go into leadership, forensics. I mean, the potential and opportunities are amazing and just plentiful. So when you really think about what top 3 skills and what 3 courses that you need to think about being a well-rounded nurse, like Professor Stratton mentioned. So talk about classes. Of course, you're going to need to be really strong in biology. Looking also at A&P, anatomy and physiology. You've got to know the body, you got to know how it works, you got to know biology. So those are the obvious, top two. Also, people don't always think about English. English is a very important skill to be able to write, to communicate, to be effective, to be able to read orders from doctors, to being successful on NCLEX too, to be able to read questions, dissect questions. And so taking that time to really slow down and understand English language and your verbs and pretenses and all the Latin suffixes, like all those things are important too. So, and then those also fall into their skills. You need to be able to communicate, be clear and effective communicators that can go back into your English as well. Professionalism is huge in nursing because you're not just only working with yourself and your patient, we're also working in teams, being interprofessional in our teams, working with pharmacists, physical therapy, doctors, advanced nurse practitioners. So you're always working as a team, being able to communicate and also being professional at the same time. And then the last thing I would say is developing your critical thinking skills. And so that does come with time as you grow, learn to probably like is important, but being able to critical think and break down ideas and concepts and knowing your patient's in trouble, when to advocate for your patient, and being a strong nurse. So those are our top 3 skills and courses.
Wonderful. Thank you all so much. Okay, I wanted to hop into the chat to see if there were any questions. So we do have a few. Can you explain the relationship between St. David's and Galen College?
So I can start. St. David's Healthcare has a unique partnership. So what you know as an 8-hospital healthcare organization partners with a corporate entity, HCA Healthcare. And although we partner with HCA Healthcare, St. David's Healthcare functions as a nonprofit organization. However, HCA is owned and partnered with Galen College of Nursing. So part of our unique partnership with Galen is that our corporate entity that we partner with partners with Galen. So that's our way of trying to help with building the nursing pipeline by having a school that is as amazing as Galen College of Nursing is for that partnership. Dr. Anna Jessup, is there anything that you would like to add?
Yeah, I think that's about it, but also the opportunities that come with our partnership too. So students that come to Galen really have 100% guaranteed job with HCA. And then on the other side, when they become HCA employees, they also work with them tuition reimbursement and so forth. And if you decide to go back to school, so you start at LV and you want to go back to the bridge program or whatnot, then St. David's also help with tuition reimbursement and those kinds of other things. So I think it's a great partnership between both Galen and HCA.
And one of the things that I think that's the most popular is your zero out-of-pocket program, that bridge program that you have, that gets directly billed from Galen to HCA. And so our employees don't see that. Can you talk a little bit more about that program?
Me?
Yes, the ADN bridge.
The ADN bridge. Okay. So yeah, so if you're an LVN and you go back to school, you do the LVN to RN bridge program through Galen and you're a St. David's employee, you pay nothing for that time. You don't even see the bill. It goes directly to HCA. HCA directly bills it to Galen or whatever the partnership is, but you don't see the bill. So you get to go back to school and advance your degree for basically free. And so that program is an 18-month program to go from LVN to RN. And then even from there, if you want to go from RN to BSN, that part's online. And again, there's that same partnership as well.
Awesome. And there are so many opportunities out there to help cover costs, scholarships and different things. So you can always reach out to Workforce Solutions if you need a little help covering the costs of nursing, because we have a ton of resources that we can connect you with as far as funding goes, for sure. Thank you.
Paige, I have a question. So I just want to give a shout out to Mr. Rocha at the Lockhart High School for bringing in his very serious students that are interested in nursing. And we had a question for the group. what are the grade requirements? I know many of these students are preparing to apply for nursing school, and I'm sure they're thinking about enrollment and the application process. So can someone kind of speak to grade requirements, maybe courses you look for? Do y'all look at resumes? Kind of expand upon that if you can.
So the basic grade requirements coming into the nursing school is 2.5. What they will have to take an entrance exam called the TEAS test. And that TEAS test is look at science, math, and English specifically. And depending on which track you go to depends on how you score on that TEAS test. Those are the kind of two big things you have to do to get in. Plus, you have to do all your clinical requirements before you start. You need to be CPR certified. You have to have all your vaccines. You have to take a drug test, a background screen. You do the background screen also through the Texas Board of Nursing, saying that you're eligible to sit for NCLEX. So there is some prep work to do before you start the program, between clinical requirements, background checks, and taking the TEAS test.
Thank you.
Wonderful. Do we want to take a moment and see if there are any questions?
What are the grade requirements while in the program?
So you have to maintain a 2.5. We do take as low as 2.0, and you can be on probation for 2.0. You need to have above a 2.5 to stay in the programs.
Thank you.
Great. Are there any students on the call that would like to ask our amazing resources here? Any questions? Okay, well, if y'all think of them, put them in the chat, okay? All right. So we do have some upcoming events with our partners. There is a Baylor Scott and White interview day coming up on March 29th. This whole slideshow will go out to everyone, as well as a few flyers about some information and resources for students. So the Ascension interview day will be on April 14th when we have more information about time and location. That will also be shared.
And I'll elaborate on what those days are if y'all are not familiar. So Baylor Scott and White interview day and Ascension interview day, these are for CTE graduates from local high schools. If you are interested in pursuing a career in healthcare with any of these hospital systems, they are welcoming you to join them to do interviews. So we do ask students come prepared for an actual interview with a resume in hand. I can give you the contact information with my colleague, which is Ashley King, and she can get you on the roster to be interviewed by either Baylor Scott and White on March 29th or Ascension Seton on April 14th. So I will put that in the chat. Again, this is for CTE graduates of 2023.
Perfect, thank you. We have for our teachers and our educators on the call, we have a signing day meeting with Workforce Solutions where we will be planning interview events within the hospital system. So additional events will be discussed at that point. And we also have the Workforce Solutions Healthcare Job Fair. This one's great because you can come in person with your resume, get ready, and they will not only connect you with open positions, but also gives you some tips and advice for maybe the resume that you've brought and how to get it polished for additional job fairs. That's also virtual, and the link is attached. There's also the Texas State University St. David's School of Nursing Open House, and that's going to be April 22nd at the Round Rock campus. So these are just a few of the events, and these are events that are happening frequently. And so it's really important to get connected with Workforce Solutions so that we can share out, because there are so many different systems in Central Texas, so many different hospitals. And when there's an event, they come to Ashley King and she shares it with us. And we have all of these things that we can connect students with. There are some action steps that students can take to get started with nursing before graduating. Things like volunteering, being a patient safety attendant, patient care technicians. Some of these, Dr. Vaughn, are postgraduate, right? But volunteering, things like that. There are some things you can get started on before you graduate. So there's information on these, as well as shadowing, which Dr. Vaughn touched on earlier. Does anyone have any questions about what that entails? Or Dr. Vaughn, do you want to share any additional? I know you kind of went into this earlier, but.
Yes, so and what I do is when I meet several of my high school students, many of them want to pursue a degree in some sort of healthcare field, whether it's nursing or it is something else, but they're not quite sure what it is. So I offer the opportunity for them to shadow for a brief amount of time in these respective areas so they can get a little bit more perspective on what that looks like, so they are better prepared when they are selecting their future career. I want to set up any program for success, because what I don't want to see is a student work so hard going through all these classes, and then midway through they're like, oh, I didn't realize, nurses had to deal with blood, and they are like, that's it, I'm done. So I want to help set them up for success. And one of the great ways is an opportunity for job shadowing. This observation will let you know in nursing, the various things in nursing. So if you're trying to get into nursing and you're not quite sure if nursing is the right thing for you, I can let you job shadow in the ED, a little job shadow in women's services, and a little job shadow in hemodialysis. And you might say, you know what, I can see that this is right up my alley. And whenever I get into nursing program, I can't wait to explore all the areas. So I would love to partner with anybody who is interested on job shadowing, and I can help you with deciding your future.
Wonderful. To the professors on the call, is job shadowing something that's included in nursing school, like rotations for medical school?
Yes, that's what we do in our clinical experiences. Regardless of which program you decide is the correct path for you, we start very small with the expectations of what you need to do in the LVN program and the BSN program. With the ADN program, because they are already LVNs, the expectations start out a little heavier for them. But you have an opportunity to go through each of the different floors. We focus on very, very small things initially, like being able to do vital signs on a patient, being able to assess our patient. And then as you continue through the program, whether it's the LVN program or the BSN program, those skills are going to expand based on whichever path that you take. So it's not exactly shadowing, because to me, shadowing is you're kind of behind the scenes, kind of just watching things. In clinicals, you do. So we start very small with what you're doing, but the expectation as you move through the program is you're providing care for the patient. So not exactly shadowing, but really more preparing to be that nurse upon graduation.
Awesome. Thank you so much. So this shadow program is a really great opportunity for students. Thank you so much, Professor Stratton. Have a good day. Okay. All right. So if you have any questions after our webinar today, reach out, let us know. This is going to be Ashley King's email, and I know that was in the chat as well, which will be shared. And let's see. Thanks, y'all. If you need to hop off, thank you so much for joining us. We really appreciate it. Okay, and then this is some more information. I know that I've said a couple times to reach out to Workforce Solutions, and this would be how you would do it. This is my email, Ashley's email, and Jessica Durson's email. And you can also follow us. Some of those resources that Jessica shared, those career pathway flyers, those are all going to be at Career Ladder at workforcecapitalaria.com. Sorry, I jumped ahead. This is for help on your resume or information about careers and training. Climb the Ladder is another resource that I'm going to share in just a moment. You can also connect with us on YouTube. You'll find other series just like this one. So this one will be going live so that we can share this out with other teachers and classes. So follow us on the social media, on YouTube. Oh, I didn't include it. I need to include that when we send this out, but Climb the Ladder is where you're going to find, it's a website that has all the career pathway information. So yeah, any questions that we have for our panelists before they leave? Oh, thank you so much, Jessica. Appreciate that.
Questions, put them in the chat. But as Paige mentioned, we did create a micro website for students to explore, students, parents, teachers, and it's www.climbtheladderctx.com. And I'll share that after this meeting as well. But it has a ton of really great videos, career profiles, information on how you can get started in healthcare. We even have a PowerPoint on volunteer and scholarship opportunities in healthcare. I also highly encourage following us on Instagram because me and Paige actually manage that account. And anytime we hear really cool open houses or job shadow opportunities, we put that on our Instagram. So that is at WFS Capital Area. And it's going to be worth your time. So definitely check us out on Instagram if you get a chance. But I do want to appreciate the students, the teachers, the panelists today for your time. And we really hope the students gain some information from this webinar and that you're able to make some really strong decisions as you go into your graduation year. So thank you all for joining us today.